So hello beautiful people, welcome back to my YouTube channel. In case you are new here and you have not subscribed, please do so. And if you are a returning subscriber, thank you very much for your support. Like my video, share, and don't forget also to turn your notification bells so that every time I post a video you will be the first person to be notified. So today I want to talk about some of the challenges that usually face nurses, some of the challenges that nurses usually encounter during their time of practice in the ward. Number one, infection. This is obvious and it is always a risk. A nurse is always at a risk of getting infection anytime, maybe the time they are pricking the patient, during when they want to give drugs, or sometimes when they are trying to dress. Though there are some of the things that are there, like gloves, they can put on to protect themselves, but it is always not 100% sure that they are safe. Maybe by mistake you can prick by yourself anytime when you are taking care of the patient, or when you are administering drug, or any time when you are in the ward. So infection or getting contaminated with some, or getting a disease, is something that usually it is a, how can I say it, it is a challenge, because it is, you cannot avoid, you can avoid it, but you are at risk of getting infection. Number two, work overload. Sometimes you get that one nurse has to attend to maybe 50 patients, 1 to 50, that's just too much. And maybe in 12 hours, imagine those who are doing night, you report at work 7:30 or 7, up to again 8 in the morning, 8 a.m. or 7:30. That is the time you will. And maybe say during in the morning, when you are supposed to go home, maybe the report is heavy, or it is too much, or it is long. You will have to wait until you give that report clearly, so that those people who are coming to work, they know what they're supposed to do. So sometimes you get that the work is too much, you did not sleep at night, you did not even put your head on the table even to just have a sleep. So you get that the work is too much, and sometimes the patients are many, and during night hours, patients I don't know, should I use this, they usually disturb, but not disturb, but you will notice that during at night is when there is a lot of work, because during the day there is work, of course, but there are so many activities that are going on, you cannot see that. So when I want to say that most of the time when you are at night is when you will see that there is a lot of work. But not even only that, even daytime there is a lot of work. So number one is infection, number two is work overload, number three, death. We can always not stand the pain of seeing a patient dying, the patient that you are taking care of, you are giving medication, you are washing the wound, you are washing this patient, you are talking to this patient, you are doing everything to this patient, and you just at some point have to accept that this patient have just to go and leave you. I mean, this patient just have to die, the patient you are taking care of, and some of them are very friendly, they appreciate. You cannot just stand that. So that is sometimes the pain that usually nurses always face in the ward. Number four, harassment with the patient. Well, this is always, it's always happening, and it is always a bad feeling. If sometimes you know that you have done whatever you are supposed to do, and at some time or a point you get that you will get some harassment that even you did not know, and some of them they can be avoided. So So let me give you a story. One day when I was in the ward, and there was somebody who lost her mother. This person, a day before the mother died, the I think it was the son. He came and talked to the mother, and according to him, the mother was doing well. According to us, we saw that the condition was deteriorating. So in the morning, the next morning, when the son came and found that the mother died, this son really harassed the nurse who was on the duty, the morning off duty. I mean, the nurse who was working in the evening. This son really harassed until this son wanted to fight this nurse, not knowing that this nurse did a lot to save the life of this patient. So sometimes harassment is always a challenge, and sometimes we cannot avoid it. They will always come, not even when you are in the ward, when even you are working in outpatient department, you will get that some patients usually they will always harass you just without no any reason, without no good reason. They think that you should attend to them before other people, so they will end up harassing you or giving you abuses, and it is not always good, by the way. Number 5 and the last one, long working hours. Long working hours. You find that nurses usually work long. They don't have time for their family. They don't have time even for themselves. They only have that time to take care of the patient. Most in 24 hours, you can get that a nurse who can work even for 15 hours, even for 13 hours, even so they don't have time to take care of even themselves, to have talk with their family. So long working hours is also a challenge, and it is also a challenge that affect their life. Somebody is standing the whole night, 12 hours and above. Will this person do this for the rest of her life or his life? You will get that at some point. This person will get headache, backache, and so many other conditions. So you get that long working hours is always a challenge to nurses. So please appreciate our nurses, not even only nurses, but health professional, because they are doing a lot to make us, or to make our life to be the way people are, or to treat us. So thank you for watching my video. Let's meet in my next video. Bye.